In this episode of the Nurse Practitioner podcast, Dr. Shannon Cole discusses consequences of dietary sugar consumption. Tell us the name of your paper and why you wrote it.
The title of my paper is Consequences of Dietary Sugar Consumption, a Historical Perspective. And I was interested in this topic because I have been interested in nutrition for as long as I can remember. I was raised by parents who emphasized proper nutrition at an early age. And additionally, I've practiced as a family nurse practitioner for 25 years, primarily in a rural setting. I've witnessed firsthand how an improper diet, especially one high in added sugars, can negatively impact overall health. Additionally, the focus of my doctoral work was on childhood obesity and nutrition. And with the research related to the project, along with my own personal interest, I began to do a deeper dive into the effects of sugar on obesity, type 2 diabetes, and cardiovascular disease.
What surprised you in your work on this paper?
I was surprised to learn the role that the sugar industry had in the research related to the causes of cardiovascular disease. As we know, industry-sponsored research, much like that sponsored by the tobacco industry, invariably produces results that confirm a lack of harm from the sponsor's product. It was evident from an analysis of studies published in the 1950s to the 1980s that the sugar industry not only paid for, but initiated and influenced the research in order to exonerate sugar as a major contributing factor for cardiovascular disease. It's been suggested that the sugar industry has tried to deflect culpability by co-opting scientists and public health officials, minimizing the impact and significant effects by diluting data and influencing public opinion through marketing.
Let's get to some basics. Why is dietary sugar bad?
Dietary sugar is bad for a whole host of reasons that include obesity, type 2 diabetes, cardiovascular disease, depression secondary to neurotransmitter deregulation and inflammation, fatty liver, advanced cellular aging, kidney disease, gouty arthritis, and even cancer.
Are there kinds that are good?
Sugar is not an essential nutrient. There are no good added sugars.
Most consumers are under the impression that saturated fats are to blame for heart disease and obesity, yet there's research that suggests sugar is to blame. Could you tell us about that?
Evidence suggests that the consumption of excess sugar promotes the development of cardiovascular disease, type 2 diabetes, and obesity. This involves the hepatic uptake and metabolism of sugar, which leads to lipid accumulation in the liver, decreased insulin sensitivity, and increased uric acid levels.
In your opinion, and after all your research, does sugar consumption lead to cardiovascular disease and type 2 diabetes?
Absolutely, and I'm not alone. Published research on the subject led the World Health Organization, the American Heart Association, the USDA, and the CDC to recommend a reduced intake of free sugars from birth through adulthood.
What happened in the U.S. Industrial Revolution that led to an increase in consumption of dietary sugar?
The Industrial Revolution brought about a dramatic increase in sugar consumption as scarcity and cost decreased. Products such as cereal, soft drinks, candy, and ice cream became easier to produce and store. This increase paralleled an increase in obesity, type 2 diabetes, and cardiovascular disease. Declines in these disease rates were seen only when there were shortages in the availability of sugar, such as in World War I.
Your paper says obesity in U.S. adults was 39.8% and 18.5% for youth in 2015 to 2016. How does that compare to earlier decades?
Worldwide obesity rates have doubled since 1980, according to a study conducted by Harvard School of Public Health. They found that worldwide, the rate of obesity nearly doubled, with just over 200 million adult men and under 300 million adult women obese. Obesity rates have steadily risen in children, too. In 2010, 43 million preschool children were overweight or obese, which is a 60% increase since 1990. A 2014 study of overweight and obese children and adults from 1980 to 2013 found that worldwide the proportion of overweight or obese adults increased. and prevalences also increased substantially in children and adolescents in both developed and developing countries.
What are some unexpected products that contain hidden sugar?
Sugar is found in essentially all processed foods, such as bread, cereal, sauces, and both canned and frozen foods. Consumers should be very savvy when reading food labels.
Some of the solutions to reduce sugar consumption are interventions that would need to be done on a governmental or societal level. What kinds of things can be done by NPs working with patients?
Scientific organizations, including the World Health Organization, the American Heart Association, the USDA, and the CDC, have recommended restrictions related to the intake of dietary sugar, as mentioned before. Effectively addressing the issue does not just happen. It's the result of collective consensus and public investment in interventions that are affordable, cost-effective, and based on the best available science. Taxation has been proposed as a means of reducing sugar intake and generating revenue for government-funded health programs. Some have suggested that even a 1-cent tax would generate considerable revenue that could be used to support obesity prevention programs. Numerous studies have also shown that as prices increase, consumption decreases. As mentioned earlier, finding a solution will not be easy, but some things that might help combat the problem are education, emphasizing the fact that there is no biological need for and no nutritional value to added sugar. At professional sporting events, companies could be banned that are associated with sugary products. Celebrities and well-known athletes should disassociate themselves from endorsement of sugary products. In grocery stores, promotion of sugary foods in grocery stores could be banned. As mentioned earlier, taxation. The taxation could be extended to sugary drinks and sugary foods. An advertising ban, to ban advertisement of sugary drinks on the internet and television. Dietary advice. Policy should prevent all dietetic organizations from accepting money or endorsing companies that market processed foods. Research. More needs to be done in the area of research with respect to controlled trials of the effect of increasing or decreasing sugar intake on body weight. Behavioral change. Nurse practitioners are at the forefront of helping patients with behavioral change. Patients need to know how to read labels. They need to know what is the proper amount of sugar and how sugar negatively impacts their overall health.
This podcast does not constitute medical advice and should not be taken as such, and does not replace professional judgment or advice. The ideas and viewpoints expressed in this podcast do not reflect the official position of the speakers, authors, affiliated organizations, the Nurse Practitioner Journal, or Walters Kluwer.